One more minute. Or less. All right, my phone says 4:30. This time I'd like to call the meeting to order. Roll call. Just notes that everybody's present except Dr. McLeory, who was out of town in Philadelphia for a family emergency. Next item on the agenda is the adoption of the agenda. So entertain a motion.
I would like to move to amend the agenda to add a approval of the new health officer.
I second the motion.
So is a motion to approve the agenda with the addition of,
With the addition of addition of voting on approval of the new health officer and the specifics of how that has to go about.
so that
I will love the official.
2320 under new business.
Okay, or can we do that first?
Whatever we want.
You want to put it
Let's do it first.
ahead of the minutes or after board president announcement or where?
Please look at my.
Pardon?
Please approve my.
How about right after board president announcements?
Okay.
That work?
So put it as item 5.
Is there a discussion?
Yeah, sure.
Okay, so approval of a new health officer. So I didn't know that we were already at a stage where you have identified who your new health officer is.
Yep.
A new health officer who's going to take Bob's place.
Yes, we have a candidate to bring forward for the board.
Okay. For new health officer, full-time, brand new health officer.
The terms of his employment are still being negotiated, but yeah.
Okay. Well, it's just at our last meeting, the discussion was, gosh, I better hurry up and get my personnel committee together and start talking about it. And here we are 4 weeks later. And we're at the point where we're hiring a new health officer. I'm just,
Heidi, you have to remember that Bob is leaving in 2 weeks. I mean, we don't have the luxury that you had finding Bob of a several month period of time.
all right,
So we had to move
let me
that.
stop you right there because I had no luxuries when I was looking for Bob. So let's not presume that you know what my experience was when I was looking for Bob, A. B, 4 weeks has gone by. I'm just talking about transparency and process.
Mhm.
Perhaps that's the way that I could frame this, is that during this discussion, I will ask about what that process and the transparency of that process, because I haven't seen not anything about anything. And suddenly now I'm going to come to this meeting today and I'm just going to vote on this?
Are you on the personnel committee?
No.
That's why you haven't heard anything about it.
Okay.
So I haven't either. It's like, we're not on the personnel committee. The personnel's job is to find the person, then bring it to us.
I'm well
So-
aware of that. I would just appreciate a little bit of a heads up before I come to a meeting in front of all of these people. And then I'm supposed to weigh in on whether or not whoever it is that you've decided to hire.
I'm finding out as well, but I thought
Okay,
that was
well,
pretty much how it went.
No, that's
You know,
not how it's
We can
gone.
just certainly discuss all that. Right? So,
Okay.
any further discussion on the motion to approve the agenda as ending that item? All right, all those in favor say aye.
I
Opposed? Motion
Aye.
carries.
Nate,
All right. Next item on the agenda is the approval of the minutes. The first minutes we have before us are from the February 15th meeting. Any discussion or I'll entertain a motion to approve.
motion approved.
I'll second.
We have a motion and a second. Any discussion on the minutes? Hearing none. All those in favor say aye.
I
Opposed, nay. Motion carries. Next item on the agenda is the approval of the March 1st, 2023 minutes. Any discussion or I'll entertain a motion?
I'll move for approval.
Motion, do we have a second?
I'll second.
We have a motion and a second. Any discussion? Hearing none. All those in favor say aye.
I
Opposed, say nay. Motion carries. Next item on the agenda is board president announcements. Just a couple things real quick. First, I'd like to thank Dr. Ankers for all your good work over the years. Appreciate your passion for the job. Everything you've done for the county. You've left us in a very good position. So I appreciate that. We wanted to recognize that. Second thing I wanted to mention is we do have an open position on the board. So if board members could please forward any recommendations to fill that seat to me. I can forward them to the commissioners. Or if you're more comfortable, you can forward them right to the commissioners yourself, but I'd be happy to pull them all together and get them over to them.
That does, sorry,
Mhm.
that does need to be a Democratic candidate, does it not?
Yeah.
Okay, that's what I thought.
Other than that, are there any requirements, Marcel, for that seat?
Well, they have to live in the county.
Live in the county, but as far as being a
And be a US
doctor,
citizen.
is that,
And be a US citizen.
they don't have to be a position or anything in particular like that?
You need to have 4 members on the board who are expert in public health, my understanding.
You do, but you also need 2 members on the board who are members of the general public. And currently, I'm the
I
only one who,
understand that, just
Yes.
wondering who the members are who have expertise.
Who are the
in
members who have
as
public health
opposed to medical care.
expertise?
That's, first of all, this is my portion to speak.
Sorry.
So I just want to put that out there. If you have any candidates for the open seat, please let me know. Moving on to health officer presentation and reports.
Yeah, thanks, John.
Oh, wait, I'm sorry, the health officer presentation, or were we gonna have the discussion of the
I'm
health
sorry.
officer now at this moment?
I'm sorry, Dr. Bob. Yes, as the agenda was amended to add the item of recommending the hiring of a new health officer. But with that in mind, the members of the personnel committee have been aggressively meeting. We've talked with probably a dozen doctors to gather input around from members of the community. One name kept coming to the top, and that's Dr. Joseph Serban. I've known of him for many years. I'm a longtime patient of South Bend Clinic, so I know a lot of people that know him. And like I said, his name rose to the top. We talked to him several times over a period of weeks, explaining the role as best we could. Dr. Migliori was very helpful. She explained the more medical side of it to him. I think she did a great job of convincing him that it's a role that he would do very well with. And from my discussions with him, he likes most everything that we have going at the health department right now that is underway. He made the comment that he was really thought the community health workers is pretty cool what we've done there. He's not sure what they do, but it's pretty cool to be out in a community like that. So I think he looks forward to seeing how to use that program. I think his demeanor, the way he approaches problems and discussions, I think will fit very well with department heads and board. I'm talking to him just yesterday, trying to get him on board. He made the comment that this county and the citizens of this county have done a lot for him personally. And he really feels it's time for him to give back, and he would be happy to do that in this role. So with that in mind, we're going to, I can't make a motion, but with that in mind, we think he's an excellent candidate. Michelle, Dr. Migliori, I'm sorry, wrote a letter in her absence supporting him. And like I said earlier, she did handle the bulk of the communication with him. With that, anything else, Marcel, to add?
I mean, Dr. Miller has known him for a long time, is my understanding. She was, like John said, very supportive of him and instrumental in bringing him to the table. I mean, the meeting that I went to with John to meet him, she had arranged. She couldn't be there because of the family thing. But yes, what is he seems I checked out the credentials. He sent us all the licensing. Everything there. So
And this was a very, that kind of getting kind of the final, should we say, agreement and where he agreed to go ahead is a very recent thing, which, correct,
Mhm.
which is,
That's-
I think, why we're really only able to talk about this now. I mean, I think, and have been able to bring this to the entire board just at this point in time. It's really been just in the past couple of days where everything's really been gelled together.
Yeah, just yesterday, actually. Tonight, he finally said, okay.
Yeah.
And maybe I should just run through his resume real quick for everybody in the audience. He's been a physician at South Bend Clinic for 30, since 1987, 30 some years, 35 years, recently retired. He started their family practice group, so he's got experience with administration, so and financials, and of course, the medical side. He went to school in Illinois. He done some clinical instruction with IU. He was a physician of the year in St. Joe County in 2017. I feel like I'm missing something, but so that's kind of the highlights.
Can I say something that I thought was fantastic?
Sure.
I looked online. He's the medical director. He was the medical director of Navarre Student Outreach Clinic, which apparently is a clinic that the students at IU School of Medicine here in South Bend have on the west side. And there's a great YouTube video, like a 6-minute video about that clinic. And he was interviewed as part of that. And that to me made me realize this is somebody who is seen and is familiar with many different aspects of medicine, medical care, public health throughout the county, both working in family medicine on in Granger, but also working both with students and working on the west side with a clinic that serves, I believe, mostly poor and individuals who don't have other access to healthcare. So I think that sort of background is going to be fantastic to have.
Great.
So if I got to ask a couple of questions, I don't know, Dr. Servant, I'm sure he's a fine physician, as you've already laid out in Michelle's testimony here and so forth. So the candidate themselves aside, I'm curious about a couple different things. One is, you were calling him a health officer. Is this technically an interim health officer, or is this the health officer now going forward? Because I'm not clear about that.
The term, those terms are yet to be discussed, but he will be our health officer.
Okay, so that's a little bit different. So are we hiring an interim, or are we hiring this is our full-time? Because we had been talking about hiring an interim.
He'll get a contract like Dr. Bob did, and there's no end date.
So that means there's no,
It's the 4-year term that's required by the statute.
Okay.
Obviously, he could leave early or.
I understand that. The last conversation though was about an interim person. So we're not doing it. I'm just trying to get clarification. We're not doing an interim is what I'm hearing. Because if you're going to offer a 4-year, then that's our full-time health officer.
Right, my understanding is he wants to be part-time. So he'll do something similar to what Dr. Bob and Dr. Fox currently.
What's that mean?
Dr. Bob's got Dr. Fox work with him as the deputy health officer. So I think that my understanding is that arrangement will continue. Of course, it will.
So we're, again, just so for clarity, so we're going to have a part-time health officer for St. Joseph County now. Is that what?
So yeah,
what you're
similar
saying?
to what we currently have. The arrangement will be very similar to what we currently have.
Okay, so maybe we want to say what do we currently have, and then how is it going to be different? I'm just trying to articulate what the parameters have been established in terms of the time that this gentleman is going to be spending with the health department. That's all.
Sure, I don't think it'll be different from what we currently have. So it's when you say full-time health officer.
I mean, I'm just asking, are they going to be here? Like, so what's considered full-time at the health department? How many hours a week?
I don't know, like, you know,
How many?
30 hours.
30 hours a week is full-time. Okay, so. But I know Bob doesn't work just 30 hours a week. So I'm just asking, like, what is the expectation? Is it 30 hours? Is it 40 hours?
I think those terms are still being worked out, but if my understanding from talking with them that it would be probably less than 30 hours.
So we're gonna go with the part-time health officer for St. Joe County now. And offer him a 4-year contract. So then what,
Very similar to Dr. Bob's, might be 24 hours. I don't know yet.
okay,
We're still negotiating it. Also, just to be clear, this has to next go to the commissioners,
council
council,
and the
and then the
commissioners.
commissioners.
Right.
So we have to get through all those things too.
sure. And then what is the job description?
We passed it out at the last meeting.
I realize that, but that was for a full-time health officer. If we're doing a part-time health officer, it seems like we would be modifying that in some way.
He'll oversee all of those.
I mean, he still has the oversight responsibility.
Job
It's,
description's the same.
Just, I mean, you can't get done in 40 hours what you're doing as compared to 20 or 24 hours.
I mean, the job description doesn't preclude being able to assign some of those duties out to somebody else and overseeing them.
Okay. And then
That's how it's written.
that's how it's written.
I think so, yeah.
And then what is the salary that we are looking at?
That's a council decision. I don't know. Those, Michelle had the conversations with regard to that, and the contract's not done. So there's still conversations going on with the council. They said the comp, and obviously the commissioners have to sign.
And we're all okay with a part-time health officer?
Permission to ask a question.
Just,
Is that okay?
If you want.
If it's helpful and
So,
constructive.
well, I'm gonna try to be helpful and constructive. So if I understand what you're saying, Marcel, is that the deputy health officer, who currently, of course, is Mark Fox, has responsibility for XYZ. The HEAD unit, the Hope unit immunizations, and there's one other escaping me. So he has primarily led, so he has primary responsibility for that and reports to me. And then I have primary responsibility for the entire department, but in terms of the unit directors, all the other unit directors are individuals who report directly to me. And whereas the unit directors of HEAD Hope, the lead program immunizations report to Mark, and that reports to me. Is that, and then, so everybody knows, there are no secrets here. I was contracted for 30 hours a week. There are also no secrets. Those of you who work with me know that I put in 40, 50, 60, 80 hours, whatever it takes. And of course, during much of the last several years, it was always in excess of 40. So just to be clear then, the expectation of this gentleman and or particularly of this board is that Dr. Fox will remain responsible for his part. And in the assuming 30-hour week contract that you will offer to this gentleman, that his responsibilities would be similar to my responsibilities then.
So I don't know exactly the departments, how they're gonna break down, right? But my understanding is that Dr. Servant and Dr. Fox actually have worked together in the past through the IU setup. And according to Dr. Servant, they have a decent relationship. So how they decide to split that up, I don't know. But Dr. Servant indicated that he would like Dr. Fox to stay on so that they could split up duties. So will Dr. Servant take on lead and Dr. Fox not? I don't know. But I do see some split up of duties similar to what you have. That's what has been discussed.
So you would anticipate a discussion between the two of them
Yes.
to occur at some point.
Yes.
So, in mind, entertain a motion to put this on. That's appropriate.
I will move to, what are we recommend? What is the term? What are we actually doing? Recommend to the council or
To hire him.
to hire? Okay.
Yeah. And then we'll certify that. And I think Jenny's got a certification form. So we send that certification form to the council.
Okay, all right. So I will move to hire Dr. Joseph Servan as our new health officer for a term of 4 years for statute.
I second.
We have a motion and a second. Any further discussion?
just want to reiterate that we are all very clear, transparent, that we are moving from a full-time health officer to a part-time health officer. Just want to make sure that we are all clear that that's what's happening. That doesn't sit well with me at all. The reason that our health department is now so well positioned is the fact that we had a full-time health officer. That's the reason we are where we are. That's why this room is full. That's why the department heads are always at our meetings and are available to us. And the work that you guys have all done in the last 3 years is because we have had a well-trained expert in the field of public health and global health and who has worked full-time. So my concern here is that we go to a part-time person and notwithstanding his experience and all of that, but a part-time person that is going to change the culture of the Department of Health.
Heidi, my understanding has always been that Dr. Einherz was setting up the department so that it could be run by a part-time health officer. So I don't think
It's not my understanding.
really, because I
We've
believe
talked-
Dr. Einherz.
We've
said-
talked about different structures. So, I mean, there was a time when we were talking about appointing an interim right now so that we'd have a little bit more time to look for a full-time
Yeah,
person.
I know that the people that you were probably thinking would be in those positions are different than who we're choosing, but I think that.
Not to interrupt, but I think we are where we are, and I hear you, Heidi. So I think what you're saying is you would make a recommendation to the personnel committee that if they could find a full-time.
Full-time person, that would have been the preference,
So
certainly.
I think we could set up a meeting of the personnel committee, to meet. John, I think you're the head of that, sometime in April or May and discuss Heidi's concern. I think that's a valid.
Changing something quite significant
Yeah.
about the way that we do business. And so I just think it's important we consider it.
Permission to speak again.
Sure.
I just want to reiterate to the board that this county will come to a standstill when as it relates to health, statutory requirements of health. If a health officer is not named and in place by April 1st. An individual will not be able to get a birth certificate, will not be able to get a death certificate. There can be no abatement orders. Nothing can be done. And with due respect, I just want to clarify. The contract stated that I had to give a 2-month notice. I in fact gave a 3-month notice to find a new health officer.
Great, thank you.
Now I'm assuming that we are going to have the council and commissioners it's going to get to them so that everything can be in place by April 1st.
I've already been in contact with the attorney for the council and the commissioners. I think the attorney for the council is here actually to see if he to get to work right away.
So you'll need a special meeting, right, in order to move this forward, just to be clear again, I mean.
Yes, and Mr. O'Brien and I have already discussed that, so that the council's aware, their attorney is aware, so we're on, we understand your concern, Bob, and I also understand Heidi's concern about the timing of everything, but like I said, we're, the timing is important, so we're doing what we can with the constructs that we've got, so no one's fault, like Bob said, he gave 3 months notice. But we are working to get everything done with the council, working here to get done.
Had we considered doing an interim? Just having somebody be the placeholder for 3, 4, 5 months so that could have more time to make those decisions and have those conversations.
So I think all things were considered. Dr. Martha started the process. And we are where we are. And like I said, my recommendation, it's up to John if you want to call it, but the personnel committee can begin and take up your concern and see where we go.
So we have a motion and a second on the table. Any further discussion?
Is there any possibility of with Dr. Servan's contract, because of the looking for a full-time person, that it can be something where at a set point, if he doesn't want to be full-time, or if we find another person that would choose to do full-time? I don't know how that works with contracts, that it would be like, hey, we have someone who would like to do it full-time.
So when John and I met with Dr. Serving for the meeting that Dr. McGlory set up, Dr. Serving seemed very flexible. So he's retired. I don't think he's looking for a career, for the next 10, 20 years. But like I said, he knows Dr. Fox. He is familiar with.
Is that something
Yeah.
contractually that we,
Under the
You don't-
statute, we have to offer 4 years. So that's what they're going to do. But like I said, I don't, like I said, the personnel committee will meet. I think that's a discussion we'll have. I mean, it's a valid concern of Heidi's, so we'll address it.
Any further discussion? All right, all those in favor say aye.
I,
Opposed, say nay.
Nay.
Motion carries. I vote aye. All right, next item on the agenda, health officer report.
Thanks, John. Just first, since this is my last health officer report of health report and health officers report, I'd just like to acknowledge Dr. Fox. Dr. Fox is the single individual within this county who has the greatest experience, the greatest knowledge, the greatest judgment when it comes to public health. He dedicated the last 3 years to the health of this county at the same time that he had to juggle the responsibilities of being the dean of the School of Medicine. And he unfortunately was the face of this department during, fortunately in that he did a terrific job during the COVID pandemic. Unfortunately, in that he bore the brunt of the criticism and unfair criticism of the misinformed individuals within this county and those who were well informed, but in fact chose to ignore the science that was quite clear. And sometimes a lot of uncertainty, and he moved forward with it and acted decisively. I will say that we met on a regular basis at one point every single day for weeks and months on end. And I supported and ultimately, of course, bore responsibility for these statements made. And so I'm very pleased to hear that you're keeping him on as deputy. He is the single person, he's the only person, he is the person in this room who has greatest expertise. And my expertise is in global health and in public health domestically down in Indianapolis. He, of course, knows St. Joseph County far better than I do to this day. So just like to thank him for his service and for being just instrumental in his guidance for I move forward with my report. You've received the packet of information, and as always, I'm willing to answer any sort of questions that you have. I do want to make a couple of comments. First, I'd like to laud the community health worker program and the grant funded by the CDC. And this has been spearheaded by Cassie White and Taylor Martin, and operationally put in place by the community health workers who have just been a godsend to this county. We don't talk much about how we as a county are actually leading not just the state, but actually the nation in a number of things. And again, I thank Dr. Fox for having the vision 3 or 4 years ago to set much of this in place. But our community health worker grant funded by the CDC, which you recall is a $3 million grant coming from federal dollars, and not a penny of which is our tax dollars here in the county, puts in place community health workers who serve as conduits of information, both information coming from me, Dr. Fox, from the Department of Health, from the various units to the community, and then the eyes and ears, if you will, listening to the community and transmitting that information back to us. They as well serve as terrific resource navigators. As we well know, the social determinants of health, socio-cultural factors, transportation, poverty or income, your ability to be literate and understand, the ability to have a voice is so important to the health of any individual and as well to the community. And it's our community health workers then that serve as resource navigators, as insurance navigators, and they're individuals who give voice to the voiceless. It can be a little frightening to some people when they hear that voice, but it's so critical to their health. And as physicians, we of course know that very well. We have been so successful that the CDC has been pointing people from around the country to Taylor, to Cassie, and to our team to say, how are you guys doing this? Why is it that you have been so successful? The state of Maryland has a grant from the CDC, the same grant we have. The state of Maryland contacted us and said, how are you all doing it? Why are you so successful? The CDC has, if you will, cherry-picked a few programs around the country to essentially say, could you use another $250,000? They've looked at the best programs and said, can you use another $250,000 in the next year to bolster your program? And they're well aware that we have been, though this funding initially was COVID, it doesn't matter whether it's COVID or whether it's heart disease or whether it's cancer, whether it's mental illness, it's the social determinants of health. It's the ability to get to resources and access resources, ability to have insurance that to a large degree determines, am I going to suffer from these diseases or am I not going to suffer from these diseases? And so we, as again, you all know, have been working on a cancer initiative for almost the last year with the CDC's knowledge, because the CDC recognizes what the power of the community health worker can be. And we recognize that if more of the population, particularly those who haven't heard as well, have the opportunity to access screening, access cancer prevention measures, we can reduce the morbidity and the mortality, the suffering and the death from cancer in this county. And so the county, so the CDC is ready to give us, or at least listen to our proposal, which will surely be funded if written properly, and I have great faith in Dr. Fox that it will be. That they want to give us another $250,000. We're going to use it for cancer. But there's a hitch. I can't ask for another $250,000, and she can't ask for another $250,000 if we don't spend our money that we were given this year. Taylor went to the police department, met at every roll call. Morning, 3 times a day? Roll call for 2 days in a row, starting at 6 and ending at 10 at night. And this is the South Bend Police, out doing community policing. Many of them had no idea that we had this program. And when they heard about it, it's like a light bulb went off. Hey, we can work with you. We want to work with you. We see people, I call them patients, they'll call them clients or citizens or whatnot, every single day who, if we can get them in touch with you, your community health workers, and many of them are here in this room, we can work together on this. And if our own police department didn't know about us in terms of what we're doing, we know that most of the county still has an impoverished understanding of what we have right here in the health department and what our community health workers can be doing. And I'll say parenthetically, they have an impoverished understanding of what we're doing and what Robin Molesky is doing, Robin Vita is doing in trying to cut down on the scourge of drug abuse. But we'll get to that in a little bit here. So we went to, help me out, Robin.
Force 5?
Force 5, thank you. Because I keep thinking J2 Marketing. We went to Force 5, which is a company right here in our town. Right here, St. Joe County. I'm talking South Bend, I'm not going to Commissioner, right here to St. Joe County. And we said, we need your help. We need to market the community health workers. We need more people throughout the county to understand what they're doing. Because cancer isn't just in South Bend. It's not just Mishawaka. It's not just in Granger. It's not just in North Liberty. It's everywhere. Just like COVID is, just like heart disease is, just like mental illness is. It's throughout this county. And this is what we have been fighting. We said, we need you, Force 5, to help us spread the word, because we can do a hell of a lot more good. And we talked to the CDC, and it was a lot of money. I thought, boy, it's a lot of money, but I'd also been in the business, y'all don't know what I did in my previous life, but I can assure you, I worked with these guys a lot in my previous life. And I knew it was gonna be expensive. But if they do their job right, we can be successful. And we went to the CDC and we said, you know, and they're always looking over our shoulder, you know, always looking over our shoulder. How often? Every 2 weeks, is it? We have, and we explained to them, Taylor explained to them, this is what we're gonna do. And they were excited. Marketing community health workers. It's innovative. It's on the cutting edge. It could be done and replicated and scaled beyond our county. So we created a contract with it. Wrote the contract, put it together, gave it to the commissioners. Does anybody know if that contract's been signed yet? Has it been signed yet? No. Okay, I just wanted to make sure. They've mocked so far. I called them up. I said, what's going on here? I mean, surely there's not a problem with what we're trying to do here, is there? They said they wanted to see my strategic plan. I wrote the strategic plan in 2020. I wrote it with your input. Went to every member of the Department of the Board of Health. I went to the community. I went to the leaders. I went to people in the community and I listened. I didn't say a damn thing. I listened and listened and listened. And I looked at the research and I went to Dr. Fox over there. I said, what should we be doing as a department? And after listening to all these people from all walks of life, I put together a strategic plan. And I submitted that to the board and the board passed it. I need you, the Board of Health, to go to the commissioners and tell them to sign that contract with Force 5 so we can spend the money that has already been allocated and appropriated so that we can get another $250,000, not from our own tax dollars, not from our own pockets, but from the federal government, just like we're going after millions and billions for roads right here in Granger and Walkerton and South Bend and Mishawaka. And let's get a little bit more money for health and let's take on cancer. I need you to tell the commissioners, sign that contract. Meantime, give a pat on the back to Taylor and to Cassie and to all the community health workers. Raise your hand if you would, please, who are here. Yeah, I mean, everyone on the CDC. Yeah, these are terrific. Yeah, please, yeah, please. For those of you who have not been on the board as much, Christian and Dr. Hayes, not all of our community health workers are funded by the CDC grant. We have some that are funded to work more with Women's Care Center, some to work more with lead, but it's the CDC grant that really provided the foundation and is the foundation that all of these community health workers stand on. And so that they focus, but the basic foundation is what enables this whole thing to be successful. So I make that comment, certainly happy to respond to, if we don't talk at all about Governor's Public Health Commission, I have this as a note here, but the recommendations have come out and we've been, certainly I've given, and again, Dr. Hayes, I'm not sure if you got this because it may have come out later, since you get the summary, that a little 10-page summary that I put together about why the Governor's Public Health Commission is leaving.
Don't quote me on that. I've done a lot of paperwork.
Could you be sure and get that to him? And I think Kristen, you got it though, didn't you, or no?
What is it?
It's why the Governor's Public Health Commission would be such a
Yes.
benefit to the health of the
I got that.
to health of the county here. Okay. So certainly we'd be happy to respond to any questions that you have there. I will say there is some sort of a glitch in the animal bite reporting, and I can't answer it right now. I just say give us some time. We're working on it. It's either a problem with NBS, but we're not sure. So just don't believe, if you will, right now that animal bites. It might be right, but I haven't convinced myself. It's a very small part of the report, and it's in the communicable disease report that you have to use a password for. And so at any rate. And then lastly, I'd just like to say that I will be giving a presentation at the Civil Rights Heritage Center at from 6 o'clock to 7:30 next Thursday. And the title of my presentation is Challenges, Successes, and a Call to Action. And it's perspectives of a county health officer. So, and I think, with that little soliloquy, thank you for your attention. Happy to respond to any questions that you might have.
You said you're gonna market the community health workers. How are you gonna do that?
Yeah, how will Source 5 do that? Taylor and Robin actually worked a lot harder on the proposal than I did, and they're much closer to it along with Mark. And so Taylor, do you want to talk a little bit about that? Is that okay? She talked about it? I can't answer it, but.
Yeah, so the proposal that we have is a 6-month proposal. Specifically for a 6-month of straight marketing. The idea is that we know traditional print isn't the most popular way of engaging people. And I say we know because I spent 2 weeks writing up a marketing, felt like a dissertation at the end of the day, by how much I looked at the national level and like what marketing proposals are the most effective and what is the best currently. There are no, according to the CDC and the research that we did, this has not been done before. So we would be the first to do something like this. So we have in this marketing proposal, they will be using Google, Facebook, various forms of our website. They will be using YouTube ads to target specific parts of our community. There'll be a general ad that goes out to everybody. So the idea is that if you live in our county and you are in an area that is most frequented by somebody who has high needs based off of our social vulnerability index, you will get more ads when you walk into certain stores or things like that, just naturally. The same way as if I walk into the Rosales, I'm probably gonna get another ad from them, right? Because I've been there once. The idea is if you're in these certain areas, you will also get more dings. Everybody though will be able to see this ad. And so the idea is that we're not using the same form of traditional media. We're having some radio ads, but you won't see us on a billboard. You won't see us at, a piece of paper or a flyer about this. It's going to be through media. We have on this proposal that we presented to the health officer, or not just the health officer, commissioners, key performance indicators that will tell us when we've hit our success. We have the clearly outlined goal that we'll have 1,000 SNAs due to specifically the
Social needs assessments, SNAs, and social needs.
Sorry, yeah, social needs assessment due to this marketing campaign that will be able to be identified by a community health worker or a community member when they say, how did you hear about us? The same way you do any other form that you fill out, saying, I heard about you through this marketing campaign. We also will be tracking our website and all of our platforms for the analytics of how often people are coming back to us after seeing a marketing material that will be given to us on a monthly basis. It can be added to our health officer's report, so you were able to walk alongside it and see this. The proposal that they have given us overall is, I think, $90,000 that was agreed upon by our team who oversee this grant, but also the CDC. That's how much it costs to have people who are going to be running the entire thing. It's not something that we as a Department of Health are capable of running. We do not have marketing specialists, analysts who can do marketing. And so we have to outsource that. At the 6-month end, we will be able to see what the overall success of the program was, and then be able to re-up it. At that point, they won't have to create anything. It should be cheaper to do it the second time around. But for the building of it, building the things that we'll be utilizing, making our landing site better so that if you go and try to find a community health worker, it's easy to navigate, that sort of thing. That first part will cost around $50,000. But if you don't approve these funds, and if the commissioners don't approve it, should I say, and we don't hear from you, the commissioners don't hear from you directly, we will not only be out those funds as a community, but our program won't be known. And I will do a small correction. It's not that some of the South Bend police knew, not a single police officer was aware of our program. and not any of it. And we've been doing the lead program. Not a single one had heard of lead 3x3, didn't know what we were doing in the lead space. And a single one knew about our CDC CHWs. Nobody knew about our maternal infant health CHWs. If we don't get the commissioners assigned this, that's going to continue. Which means there's going to continue to be people who are need assistance and they are not going to be connected to those resources. And that will be because this doesn't happen. We can only do so much word of mouth. We can only do so much paper flyers. We need to have something more substantial.
So you said everyone in the community will be able to see the ad. What does that mean?
Yeah, so there's that, remember that targeted part that's called geofencing. There's a targeted part that if you go into certain areas, you'll see it more often, but it'll be open on anything. It'll pop up hopefully on your YouTube. When you have the YouTube ads, it'll pop up on your Facebook. It'll pop up on, everybody will have access and we'll be able to see it. And then we'll also, some of the specific things of like the website is open to everybody, but some people will have more floods of the ads. So like if you more often, if I go to REI once, I have all of their ads for the next month, right? Versus if I never go to REI, I'm probably gonna see their ad 3-4 times. Kind of thing.
Sounds like that, I mean, the innovation around it is awesome. Doing marketing of public health, it's exactly the direction that we need to go, right? We talked about this at the last meeting about the communication between us and the county council and the county commissioners in terms of communicating the work that we do, but the importance of being timely about approving things and improving things in general. I've voiced my concern to John that I'm concerned about the county council as well as the county commissioners, that there seems to be some new development around that they don't seem to be supportive of public health. I mean, they come out and said it so much when they're telling us we don't need this or we don't need that and you need to do this, or constant questioning of every move that we are making now. We hire people just like everybody else in the entire universe hires people with talent and expertise. That's what's represented in the room. And yet we have people who are not trusting of that for them to do their jobs. So I'm not here saying that I know the answer, because I'm baffled by this environment. I've been in public health for 30 years, and I have never seen the disdain for public health that plays out at our county council meetings and our county commissioner meetings. It's overt. I feel like it's a war on public health, to be perfectly honest. I don't feel that this is collaborative anymore. I don't feel problem solving anymore. All I ever hear about is how can we destroy and destruct? How do we take it down? Do we need community health workers? Nah. Do we need CDC money? No. And so, John, I'm saying to you that as I did in the last meeting, what are we going to do to bridge that and turn this around? Because public health is essential to our community. And that's, for me, that's our job number one as a Board of Health, is advocacy. And so what are we doing to advocate for our Department of Health?
Right, well, I think it's something that we all can do. I think being informed about the needs when we need to advocate. There are several instances where I just wasn't aware that the health department had a need, either with the commissioners or the county council, and that's, we can't speak for the rest of the group. But even the mental health thing, I was shocked. That thing that I think may have pushed you over the edge. I had no idea that you were that passionate and that you were even involved. I would have loved to have supported you on that. But
What pushed me over the edge, John, just for the record, was not that.
oh,
It was an expression of lack of trust and respect.
well,
That was the.
I think we can earn the trust again very quickly with some good, shrewd moves and thoughtful moves that reflect the needs and the wants of the community. And I am in constant contact, not constant contact. I have an open communication with county council now, as your suggestion from the last meeting. So I've got some phone numbers that I can now say, what the heck is going on? Why is this a problem? Those kind of things. So I will do that, and I will certainly engage the board and all the way along to make our case to those that appointed us and those that oversee us. So I'm not bothered by the oversight. That's their job. And I welcome it, and I think we can ride.
Timely, right? Oversight, everybody has oversight,
Sure.
but don't hold things up, right?
Yeah.
Just keep moving us along.
And I think, we've, one of the items on our agenda is, we may need to have some special meetings so we can get our systems in place. And I think the county council, I can't say what they'll do, but we can certainly ask for special meetings, and I think they are sympathetic to our need, especially go to them as a board with the request. Thank you for your report.
Do we have?
Oh, do you have any other questions? I'm
Oh,
sorry, yes,
yeah,
Any other
I-
questions on the health officer report?
Yes, I did have some questions on the report. One thing I'm curious about with the countywide lead initiative, this is something that I've been thinking about more recently. Is the presumption of the countywide lead initiative that the entire budget is going to be spent on lead remediation?
Lead remediation?
Yes.
Oh. no.
I mean, like on lead, it says during our budget discussions, this is how it's described, the lead initiative. During our budget discussions, the importance of lead was stressed and the auditor, commissioners and council created this fund and provides the funding for it.
Yeah, it's
So,
certainly not on, Alan, not on lead remediation.
Or
As
just-
such, there's, again, we go back to the social determinants of health here. And so much of preventing lead poisoning in this county, for that matter, around the globe, it is really, one needs to examine the problem holistically. It gets down, it cuts across housing issues, and so we, if you will, touches on housing, because we know that it's houses before nineteen
so you're
seventy-eight.
saying that it's just, we just use this as like a second general fund?
No, we don't. We use it to focus on lead. But there are things that sometimes, if it's focused on lead, it may also help with X or help with Y in addition to lead. But the lead fund is created so that we can have more of a focus on that, just like what I'm trying to do with the cancer initiative. So with the cancer initiative, the lead initiative, it's more of a focus recognizing that its effect will go beyond that. With lead, for example, we're beginning, is Nancy here? Here, so we're beginning to focus on identifying children when they're born and following up at year 1 and year 2. And so it's a focus, but it does touch on other things.
Okay, so the people whose I always assumed that the employees whose salaries were funded out of the lead initiative, they did all of their work on lead,
Yeah,
but it sounds like they don't.
a lot of people who are not funded by the lead initiative do work on lead. People who are funded predominantly by the lead do most of the work on lead, but there's a little bit
So
of
is there
play in all
Is there a
that.
reason why we have a separate lead fund then?
So that we can focus on lead. We have a lead team, and the lead team meets on a weekly basis. And it cuts across almost every single unit control of lead. And that, this table is filled on the time that we have the lead meetings.
So one of the things I've noticed is that there were, at the beginning of the year, there were some like certain job titles changed, and then I think there were a couple of positions that dropped. In particular, like in a safety pin grant, I thought you were going to keep, I thought you'd said in the past that you're going to keep the FEMA position open, the FEMA coordinator position open. It even says in the safety pin grant, while maintaining the FEMA coordinator position to fulfill activities related to case review. But there's no FEMA position listed. Did that just happen at the beginning of the year? Like last year, you would have had like FEMA coordinator listed, and then there would be no salary budgeted, but it was just open so that you could hire somebody.
Be happy, if you want to
Yeah.
take the time. We'll go through this entire budget. Is Amy here? Where are you?
Over there in the corner.
Amy?
Okay.
We'll go through every single step line by line, or maybe it would be better for you to come and meet with Amy and me, or Amy and Mark. And any of the other Board of Health members who might want to go through this in detail, be happy to go through that. But it's not like we're trying to hide anything from you.
Okay, well,
It's, you know, when you, I know you've not managed an organization before, you've not managed, a department like this before. But this is how it works. It works this way in a university. It works this way within a practice. It works this way. There's always a little bit of gray around the edges here where I may help with this and they may help with that. And I'd like to say, you give me $1 and I'll spend it in 3 different ways.
no, I was just wondering,
All right,
with-
you give me $1, I'll spend it.
well,
and make
with
$3. Yeah.
positions, job titles, usually,
What happened is we tried, when we applied for the last safety pin grant, the goal was to have a second position.
okay,
And we interviewed some folks, that was a part-time position, nobody
okay,
loved it.
okay,
That's all I have.
so that's it, it's gone.
So, right, so and then we held it open for a while, we didn't get more applicants, and so then what we've done is we have some contract positions to help abstract medical records and help with internal interviews.
Okay.
So, so using the money that way.
So I guess, I hope this is not awkward to ask, but the budget for your position, it looks like the way it's being paid out, it'll be done in May.
No, I'm.
Oh, no.
Right through September.
Okay, that's why I'm just, because it's,
I don't know how it works on there, that Amy would have to.
okay.
I just know that, go ahead.
Oh, because so the grant itself is valid until September.
Correct.
Okay, because it seems like the salary payout would be done in May, and I was wondering if there's
That's
other
the-
funding that's coming in.
And I have a request to the council that will be on their committee agenda at the end of the month to transfer funds from the contractual services account that are going to be unspent to be able to fulfill
Oh,
the
okay,
rest of this.
I see, okay, all right, thank you. let's see, see. For the positive childhood experiences, they talk about that there's a project where they're collecting data with Southland Community School Corporation and data visualizations with St. Joseph County Cares Committees. Is that going to be available to the public at some point? It's on page 33.
The summary data.
Or is that already available somewhere?
It's not, he's been working with, it's been a slow process because of turnover at the South Bend School Corporation for accepting for them to present it to all the different social workers of the findings. And that was just the pilot program. He's doing the full launch this, coming in May for the South Bend School Corporation.
So that's when the data will probably be.
I'm not sure. I'll have to check in with him on when
Okay.
the summary would be available.
Okay. And then,
But do y'all understand, since you're new, do you understand what the ACEs and PACEs program is about here? I do want to make sure it's so important.
In the general sense, but I wouldn't complain for your expert description.
I appreciate that. So when we looked at the burden of suffering in this county and across the state, there are 3 big categories. And by burden of suffering, we look at either by death, mortality, or by morbidity, disability, adjusted life years, or DALYs. So looking at DALYs and looking at death rate, one can lump it into 3 big categories. It's cancer, and it's heart disease / stroke. And then the third one, right up there about the same in terms of burden of suffering, is mental illness, particularly if you lump mental illness all together. So if you take drug abuse and anxiety and depression and suicide, you put those all together, that causes as much suffering as the other 2. So as a health department, we looked at the literature, looked at the research, and asked ourselves, what are the evidence-based strategies that can help prevent these things from occurring? And believe it or not, there are some, particularly in cancer, but in chronic disease of all sort, it's now recognized, and this is data that's come out in the last 30 years, starting in 1990, didn't have it even when I was in med school, that adverse childhood experiences are associated with chronic disease of all sort. And the more adverse childhood experiences that you have, the more likely it is 10, 15, 20, 30, 40 years down the line that you will develop chronic illness. And it doesn't mean, adverse childhood experience is basically trauma that occurs to a child. The trauma could be through divorce, it could be from abuse, it could be from some sort of behavior, but at any rate, a parent with drug abuse. And it doesn't mean, and we looked at the ACE scores, as you're probably well aware, and you, Kristen, as well aware, the traditional test is a 10 items test, where on these 10, if you have more than 4, it's more likely that you will have some of these chronic diseases. But it doesn't mean that you have to. So if you have 10, if you score, if you score a 10. And the thought is, and the research shows, that there are resiliency factors that can be they can intercept this process toward chronic disease. And this is what we call the positive adverse childhood experiences. So what we as a health department decided to do is we would bring on a ACEs coordinator, adverse childhood experiences coordinator, would begin to understand what is it that the health department really can do, particularly in reaching out to partners within our county, to begin to first understand the magnitude of the problem that we have here in this, and by reaching out to school systems particularly, and then working through partners to identify and implement more robustly the protective factors, the mentoring, the whatever that needs to be done to improve the health of this county. Now, this is not short-term, right? We're talking about generation, sometimes even generation change, but this is what needs to happen. We need strong families. We need children who have horrific childhood experiences, and we know that, of course, this is not happening. And so the question is, what can the Department of Health do to try to catalyze that whole process of resiliency a little bit more? Work in progress. It's one of the reasons we reached out to. We're doing it in partnership with the University of Notre Dame, Ted Beauchesne and his group working with us on this. And it's going to pan out, but it's going to take some time. So that's the ACEs PACES. Yeah, you're welcome.
So with this grant that you were talking about prior, you're just targeting cancer, or are you also, is that the number one thing in our county?
With the 250K, you mean?
Yes.
With the 250K, we're gonna focus that. The proposal to CDC would be that we'll try to expand a little bit what we're doing in cancer. And it's not just all cancers, it's preventable cancers. So we'll look at preventing cancer of the cervix, because we can do that. We'll look at preventing and screening for early diagnosis. So we can prevent cancer of the cervix. We can prevent cancer of the throat. We can prevent cancer of the colon, and we can find it really early. So if they get access to care, we can cure it early. We can find cancer of the lung early with CT scan if individuals know that they can get the high resolution CT scan and they know when to get it. So it's this prevention measures and screening, particularly for these 4 cancers, because we know that we have prevention and screening strategies that absolutely work.
And is that the number one thing in our community that would be beneficial? Meaning, my passion is mental illness.
Right.
So I feel like that would be our number one problem in this community, but I'm just trying to say,
it's those 3 together. It's cancer, it's heart disease, and it's mental illness together. So we're working on all of it. So why did I spend, and Lori Muro, who's here, why did we spend the last year and a half, almost 2 years planning the behavioral crisis facility? Because that is one component of addressing a mental illness. Why did I hire, when I came on board, This health department, believe it or not, didn't have a clinical social worker in it. Licensed clinical social worker. And yet these are the individuals who have the most experience, more so than you and me as a primary care doc, in managing mental illness. And I thought that not that we wanted to do counseling here, but we needed that experience and that perspective as we're helping to envision where this Department of Health should go. To help us keep our feet to the fire, right? And hold us accountable. And a licensed clinical social worker, I wanted that, not that I was always going to agree with her, because, and not that she's not going to, in a public meeting, tell me that I was just in error, right? Which she just did, right? But seriously, so yes, we're doing things in mental illness. We're doing things in smoking, in cancer, smoking as a risk factor for heart disease. There's relatively little, but we've looked into this, relatively little that a health department can do that's been evidence proven to actually address heart disease beyond diet. It tends to fall more in the realm of medical care. Cholesterol screening and that, but beyond diet, beyond diet and education. So we do focus on the education part of it, but I'd love to do it all. And if the Governor's Public Health Commission recommendations are passed by the legislature and they're going to need to hear it from you, we can do more. We can do a lot more. And our focus, as you know, Kristen, is going to be on health promotion and disease prevention. And do that in complementary to what we as physicians do in terms of delivery of medical care. And we'll focus a lot on social determinants of health. And quite frankly, try to make sure that everyone has the opportunity to access this care, which I know is important to you.
Okay, I have probably just one more question, I guess, set of questions on the report. And specifically, so with the National Birth Equity Collaborative Assessment, so that's still on schedule to be received by the end of March? Yeah. Okay, now, one thing that I am, there are a couple of things that Sally said at the last meeting that I just wanted some clarification on, because I kind of listened to it again. So first of all, you said last time that your plan was to, if you had the cafes, and you did have the Women's Care Center Cafe.
Yeah,
did you share the results with the NBEC? You mentioned.
Okay. The first few cafes we had, which were October and November.
Okay.
The slides that I've shared, I think multiple times, that those impressions and themes, that was the only, those initial ones are what we shared to serve as the community focus groups.
Okay.
And so nothing from that has been, that was it. And then as part of that was it. Yeah.
So that would have been the October, November, and December one.
Actually, I don't even think, to be honest, that the December one was in there. Because yeah, I don't think, because those slides were made before we did the December one.
Okay. And then I guess I just want clarification too, is that it sounds like you're planning to use the money that's in dispute between you and the council. You said you're planning on using it to buy like gift cards and refreshments for the cafes.
That's what we've been doing so far.
Okay, but you also mentioned that you might use it for other things. Like at one point you talked about seed money for when we figure out what to do next, and maybe using it to apply for grants.
Well, or as like the like when you apply for grants, it's always good to say, we have $5,000 towards this project. So, so the idea of the cafes in general is, we have lots of quantitative data from our FEMA work. So this many people smoke, or this many people had a preterm delivery. So qualitative data is storytelling. And we have some of that from FEMA because I interview mothers who had a loss. But part of the reason we decided to do this is because what we want to do is prevent losses. So speaking to the broader community, not, important to talk to people who've had a loss, but speaking about pregnancy in general. And so then, as you get these different themes and, in the slides, postpartum support and or support during and education during pregnancy. So the more cafes we have, the more people you talk to, that's stronger information. And actually part of this, the process is all the people who participate, you invite them back. And actually Taylor knows more how you handle how this process works. But you bring them back and talk about here's the findings, and you share the findings with them. You don't just kind of get the information from them and then take it and do what you want with it. You get that. Mary actually knows. And then I should have somebody else explain. And so you take that information, you share it with them, and decide together what would make the most impact, and then so of course, if you're going to do some kind of whatever the programming would be, you need money to do that. And because everything we do in the Feeling Mortality's grant funded. And so that's what you do.
So, like the Women's Care Center, my understanding was that the cafe that you had, you just went to one of their, was it infant newborn classes?
That's how they decided to do it.
Okay.
It's because people already are coming there.
Yes.
Yeah.
Yes.
And so it was.
So are you thinking, are there any plans in the works to go back? I mean, you talk about going back to the same group of people and showing your
Well,
findings.
and so we would invite everybody from all the cafes
Mhm.
together to come to the findings, because it's not just the Women's Care Center
Mhm.
information, it would be information from all the
Yeah.
mothers put together.
I guess I just assumed that for some of these moms, this is part of their regular schedule, their regular weekly
There
schedule.
isn't a reason we couldn't do that.
Okay.
We usually, Helen, we usually do a pamphlet, a paper that we have one. We presented actually with qualitative and quantitative data yesterday. But we give out a flyer that if you are not able to make it, there's this wonderful flyer that summarizes both the qualitative and quantitative data from what was said. And so some people can't make it to all the feedbacks. That's understandable. But then it has a contact information of like, would you like to be a part of this process? Would you like to be a part of the solution finding and implementation process? And so for those that can't get together, or we would provide those still to community partners who had them.
And Taylor, would you anticipate, because I haven't done these before, so especially since we're having, we've been planning these at other community partners, including obviously sharing all the results with them as well.
Yeah, and that's an important part. So we have one scheduled at the Casa de Almasad. We have one scheduled now at the upper room.
These are kind of, well, the Casa one still go forward because that one was planned before but we have stuff planned that's on hold.
Yeah,
Okay.
so we can't do them at this point.
Just clarification, is this more birth cafes or more like results sharing? Or I guess is that a type of? birth
Well, I
cafe?
mean, we want to have more of the sharing story. I mean, that's the plan.
Okay.
They're on hold right now. The La Casa one was planned before the money situation, so they were, very little cost to do these. We had refreshments and things just because it's nice, and have gift cards because you want to thank people for their time.
But you could do them without those things.
Yeah, but then you're asking.
It's not customary anymore.
Yeah.
In the field of science and qualitative research, which is my area of expertise, this is absolutely standard and customary.
I guess I was just thinking of a place like the Women's Care Center has a normal weekly moms group anyway, which is the sort of, and
But
they,
we want to go to other organizations.
Because not all women go to the Women's Care Center, right? And then the other side of that is, I think it's really important to, we talk about us being experts here, our staff, right? You pay me to be an expert. I'm paying them to be an expert in the community and who have lived experience that is honoring with dignity and respect. That if you show up and you give me your time, I'm going to honor it. When I'm asked to go speak, I'm honored for speaking, right? Like that's the kind of thing that we're asking them to do. We're trying to support that. And those moments of you're uplifting my voice, you're empowering me to believe that my voice matters enough to show up and provide something for me and make sure that this is a good experience for me. That feels wonderful, right? Like we all enjoy that. They enjoy it as well, but often are not given those opportunities to have that.
All right, are we ready to
okay,
wrap
yes.
this up?
Could I ask a quick question?
Sure.
Is that okay? I just wanted to know, since you brought it up with Women's Care Center and the monies that have been held up with the county council, we have since now received letters from, I think I saw Beacon, St. Joe Health Systems, and Notre Dame. I didn't know if there was another one, but those three have written in requesting that the dollars be released. Do you have any update from from any of those conversations.
Sally, do you want to speak to that?
We just met earlier just to find out what the process is to request that it be put on the agenda.
I only got an email from Beacon that said they didn't want. Or maybe I read this wrong, and I can't get my internet open, of course, but that they would only want to use the money for the cafes, that they would not allow.
Yeah,
it
that
to
is
use for
correct.
women's care
That's correct.
center.
These- That's what all the letters have said. And so the
Okay.
concern here is if these are donated dollars. These are donated dollars that have been donated by multiple different partners of multiple different stripes out in the community. Donated to support the cafes, but the council to this point has not appropriated those dollars. Again, these are not tax dollars we're talking about, but they were donated for a very specific very specific purpose. And the council has not been willing to appropriate those dollars.
And can they actually, so those are dollars that were already donated,
Right.
so can they actually? Do they have a say in that? Once they give them to us, they can, you know what I mean, like,
They have to be accepted.
no, I mean, that they would take them back if we don't do exactly what they say.
The
we
donors,
will.
Absolutely.
oh, sure.
Interesting.
This is common
So
throughout all of
why do
philanthropy.
you think that is, that they don't want it to be used at Women's Care Center? Like, why do you think that
It's
they are
because
not
they want
meeting
it to
that
be
agenda?
used for a specific purpose, and they don't want to be caught up in the politicization and the partisan politicization of healthcare.
And
And
you think-
basically, they've said, just like any other donor, you know, if I give my money to Mr. Levin or an orphanage that he happens to be associated with, and he says, well, why don't we give that money to these good
To
people?
another orphanage,
to,
though.
or to Kenya, you know, and I'd say, no, I wanted my money to go to.
You know what I'm saying? I guess.
Well, I
what's
guess
the
I wanted to
difference? Like,
clarify is that the dollars from the donors came to the health department to work on the FEMA initiatives, right? That's the reason it came to the health department. It was a county council person who suggested, hey, why don't we give that money to Women's Care Center? So it it came outside of the system, you know what I mean? It came outside of that. The donors that was never part of any of the
So is
discussion.
there a big difference? I
In
guess.
fact, there is.
There is actually.
I don't mean the money.
No, there's a huge difference.
I mean, then what Women's Care Center is trying to accomplish compared to what we're trying to accomplish?
Well, there's not.
Is there a big
At the
difference?
ultimate end, I think we can all say that we're all about reducing infant
Right,
mortality.
right.
I think we can do that, but some people do it this way, some people do it that way. And we can't agree on who's actually doing it the right way. The donors
Yeah. which
are
is-
saying, you, the health department, are doing it the right way. We're giving you money so you can continue to do what you're doing. They could have given it to 55 different organizations.
Yeah.
They very deliberately chose not to. And so it's just a question of honoring a matter of honoring what the donors intend.
So there's I'm just saying there's no way to appeal. Like, I'm gonna assume this money is not coming to us. So that's meaning let's say the council says no. Isn't there some way to appeal to get that money and use it for the Women's Care Center or another program? Like, if we're polarizing,
But
we're like
remember,
this.
But remember that came to us by donors and then
Right.
that is stipulated in that
But we can't
process.
appeal to the donors in some way to be like, hey, can we use this money for Women's Care Center? Why are
They
you?
they just wrote the letter.
I know. And why are they opposed is what I want to know.
Because they wanted the health department to
Because they want to
do.
empower the health department, because they actually believe in you, Kristen. And they
Well-
believe in this team right here, that we do not have a dog in this hunt in terms of partisanship. We are not.
And Women's Care Center does. Is that what you're saying?
I'm not saying, I don't know.
I mean, I don't know. I'm just
I'm
saying.
not saying anything against, for, or anything about Women's Care Center. I'm talking about.
I just
Health.
want it.
I know you
that's
have
what
a
I
grant
thought.
already.
That's what I thought. I thought we were
Grant for a specific purpose there, and if I may. When,
Briefly, please.
and I will be brief, but because this involves me, And that it was brought up to me. And I just want to say, we have this great program with our CHWs. It's a $275,000 program. This is $7,800 left from our conference that was meant for our use. But I just want to say that, and Anne Mannion very kindly wrote a proposal. I mean, I wasn't aware of until I received it from Amy. But anyway, much of what they talked about in here was about educating the importance of prenatal care. All these, we're already doing that.
Yeah.
The funds that we are using are to, listen, everybody's working to help babies, right? Everyone
Right.
is. They serve, by their own numbers, half the mothers in this community. Other organizations serve people too, right? So what we're trying to do is get the feel from the entire community about what, we weren't even done planning cafes yet, it's sometimes the stuff you kind of make it up as we go along, figure out what to do. So that's what the purpose of that is. Not for counseling at Women's Care Center. It was for engaging the broader community.
Two things. First of all, yes, they serve half the women in the community, but I mean, by their own stats, they serve 87% of the single moms and 81% of the moms of color. So I think all of the, pretty much this is almost the entirety of the demographic that I think you're trying to
And yet we
reach.
still have some of the highest infant mortality in the state. They are
Yeah.
not doing it alone. Nobody's doing this alone. And so the money, I guess I will just say,
But
the last thing I will say is the money was meant for use by this program.
And I guess that's where I'd like to know if there was some sort of oral agreement or something that we're not aware of with the donors, because I guess the scholarship invitation, the way I read it, your gift will support the April birth equity events, and net proceeds will be used to continue community engagement, awareness events, and outreach to mothers and families by the Birth Equity and Justice SJC Committee.
Yes.
The way I read it, the
What
proposal,
document are you reading for?
I'm-
Which page is that?
this is, did Amy Drake send this to all of us? But this is,
I didn't receive.
That doesn't look like anything. What is that?
no, it was, I think there was I know that Amy Drake, Councilwoman Drake, sent information about the plan with Women's Care Center to all of us on the board a couple of days.
An email.
Did you not, an email, I'm sorry.
Yeah.
Yeah,
I think.
From Councilwoman Drake, she sent us that report.
Jenny did.
no, wait,
I don't.
What's the title of the report? So I
no,
can
it's just
pull it
an
up.
email. No, this is just an email exchange she had with Amy.
Can I
I'm sorry,
suggest
with Sally.
something to get us moving here? Councilwoman Drake proposed what she thought would be a solution to getting those funds released.
Okay.
It sounds like our donors are not on board with that, so we have to go back to the drawing board and see if we can't figure something else out to get those funds
Yeah, I
released.
just don't want to lose
Okay.
that money.
Yeah, and we're certainly committed to doing that.
And with due respect, I'm not sure it's the business of the board. I mean, you're really interfering with the operations and the daily operations.
Oh, that's
I was
true too.
Take it back to our birth equity committee. That's true to them if there's something else we think would be satisfactory to use the money for.
That'd be great.
That's what it's meant for that work.
Any other questions on Dr. Bob's report? Okay, hearing none. Real quick, before we go to new business, if you want to speak later in the public, find out at the desk by Jenny. New business, item 2316, presentation of the 2022 St. Joe County Department of Health Annual Report.
So you should have all received a week or so ago, the annual snapshot for the annual report. And happy again to answer any questions. It's headed with, it leads with just a very short letter from me, short to the point, highlights some of the more significant accomplishments of the past year. And particularly, I'm personally particularly proud of the last paragraph of what's stipulated in the last paragraph. And we really have been remarkably fiscally responsible as a health department for the first time in forever. We have actually finishing the year in the black. We right-sized the department over the last year or two. We've increased our reserves by nearly $2 million. We were really hitting on all cylinders and doing so in a highly fiscally responsible way. And at the end of the day, this is the remarkable work and the productive work of not me, but my team, the unit directors and the people that are sitting in this chair. And I'm just so enormously proud of what they've done.
I just have a comment observation. I really enjoyed reading the report. I thought it was easy to read, gave the highlights, it's presented well, was organized well. There weren't really any surprises because we get your monthly report every month. So it was a great summary of the year's work. So thank you very much for that and the work that everybody put into it. So those things are not easy to put together.
I just have one question, and mostly it's because this being your last board meeting, it's kind of one last chance to pick your brain on this, but what I've noticed, I was looking for this and then I looked at annual reports just to look at the birth and death statistics. And in our county, births are going down and deaths are going up. And even if you, I mean, there was a spike with COVID, but even if you eliminate the COVID deaths, deaths are going up. And I was wondering, which is obviously concerning, I was wondering what you think might be causing decreased birth rate, increased death rate. Even besides COVID, because I subtracted out the COVID deaths and it was still going up. So.
Yeah, life expectancy, unfortunately, across the United States is going down. And when we figure life expectancy, deaths that occur earlier in the lifespan obviously decrease the life expectancy. So if the population is dying at age, had been dying, at age 88, you have a few 87-year-olds die, few more than last year, the life expectancy hardly changes. But if you see in adolescents and individuals in their 20s and 30s die, that can have a pretty significant effect on life expectancy. And unfortunately, what we've seen, and I think it's in this statistic, the increase in suicides and the increase in deaths from drug abuse.
What's the age demographics of those suicides and drug abuse deaths? So talking 20s, 30s?
I can get that for you. It's not in the 70s, 80s as much as it has been. What we're seeing the increase in is in people your age, my age, and the accidental drug overdoses. So much of this, I have to be a little bit careful here, because with the high potency fentanyl that we're seeing now, many of the deaths that are occurring in younger age groups, I'm talking teenage and 20s, are not due to individuals who are routinely abusing or have a drug use disorder, if you will, opioid use disorder. But these are individuals who, like many of us in this room, who experimented a time or two in our high school, college, or early 20s age. And unfortunately, that sort of experimenting now with this very high potency fentanyl, it can be just deadly. And this is what Robin has been trying to address here, but this is occurring across the United States. And all of us are struggling with trying to understand how do we address this problem more effectively. We've been doing some really terrific things here with our Narcan distribution. One of the problems we have, of course, is that if you save a life, oftentimes you never know that. Somebody uses Narcan out in the field, oftentimes it's not reported at all. So it's very possible, in fact, I would say likely, highly probable, that in fact, if it had not been for our Narcan distribution, we would have seen more deaths. If it had not been for the ways that our county has been attentive to the needs of the homeless and the work that Harry's doing, for example, we would have seen even more deaths. But we can never count that. We never know. Yeah, this is the other thing I'd say is I think we all recognize that the drugs, well, by and large, the opioids are not coming from within this country. They're coming from China, through Mexico, and and on up. Somehow we need to figure out how to stem that flow, but that's not gonna be us. We can't do that. We can maybe help a little bit with the demand. But that's really tough too. This is why we do ACEs. That's why I'm focused on ACEs. Let's get it early. Let's get mentors, work on these resiliency factors. And I'm not saying that every kid who died of overdose, had a tough and a rough and a bad parent or anything like that, or bad parents. I'm not saying that at all. But we do know that some of those kids were really struggling. They turned to drugs and that was their crutch. And we need to we need to help these kids. We can do that. We can do it. It's gonna take time.
Okay. Thank you. I'm sorry. On the new business. Couple of hopefully quick items. If these take too much discussion, we can table them. I don't think they're urgent. I'm sorry, on the next item, which is 2317. Discussion regarding allowing the use of resolution 01-2021, meeting electronically for special meetings only.
John, I hate to take it back, but we actually need, this did get submitted to the commissioners as my report. But we need to submit to the state.
Oh, yeah.
And I just need the Board of Health to either approve or not approve. Before I can submit to the state.
All right.
So sorry for the interruption.
No problem.
I'll move to approve.
We have a we have a motion and a second. Any further discussion or questions? All those in favor say aye.
Aye.
Opposed, say nay. Motion carries. So we have a policy in place, which is that resolution there to meet virtually or electronically. And at the last meeting, we talked about having special meetings in order to get grant approvals or whatever. Do we want to consider allowing use of that policy for special meetings only? We'll keep the regular monthly meetings in person only, but special meetings can be virtual, which means you have to allow, I think, if it's public, the public be virtual as well. And again, this is not urgent, so but we would.
Are you allowed to vote if you're virtual though?
Yes, if we follow that resolution. That makes sense or not?
I think it does.
I mean, it makes sense to me.
Would we decide meeting by meeting? Would like every special meeting be allowed to zoom in, or would it be like we decide meeting by meeting? If everybody can come in person,
We'd have it in person.
we could have it in person, but a circumstance like now where Michelle can't be here because of, she has to go out of town.
Well, this is expressly for special meetings though, right?
Yeah, but
Not
if
for-
it had to be, yes, if
Okay.
it had to be, it had to be like if this was called as a special meeting, something had to be done urgently.
I'm open to that. Marcel, is that?
How would that?
I mean, we need to set whatever the policy is. So if it's special meetings, it'll be all special meetings. If it's all meetings, it's all meetings. We can't pick and choose, right? So
Okay.
whatever we're gonna set, we're gonna set.
So that wouldn't be like budget committee or personnel committee meetings. They would, okay. Okay.
So if you guys remember, like there was urgency expressed by the department for grants specifically. So the grant came up and the department did not have enough time between the board's next regularly scheduled meeting and the funding request date. We need a mechanism to approve it, and that mechanism is special meetings. Now, obviously, you guys are all busy, so getting everyone together for a special meeting on short notice is probably difficult. We need at least 48 hours, but the thought for Mr. Lynn is, if we allow the Zoom policy for those meetings, we could probably get a quorum and get participation and get them approved for the department in a time to back.
I guess the only other question I have is the resolutions, the statutory, I haven't looked at this, so I don't know the statutes that allowed special meetings. Are they still in effect, or they're not COVID specific?
They were not COVID.
These are not the ones that
specific. I
are
have
specific.
not looked back those since that was passed.
Okay.
Would you like an opportunity to do that?
I can't, sure.
Maybe we should just
We can table it.
hold on this till next year.
Pull it over.
We have to take action on the table, or if we could just move on.
Thanks.
Next item, discussion regarding grant request process. In your board packet was a process that was laid out by somebody in the department. At the last meeting, somebody said, can you please tell us what the process is? So it's spelled out every step of the way there, just so everybody knows the process.
So do we have to vote on this?
I don't think so. I don't-
It is the process.
Yeah.
This is
Something to
the-
vote on. It is what it is.
Okay. Okay,
Please follow.
all right.
Next section of the agenda is grant request 2312, which you recall, we talked about at our March 1st meeting and decided to table it since it wasn't urgent. The Nacho Mentor Program. This is a request approval from us to recommend to the county council that they receive the funds.
If I recall correctly, yes, it is our approval to receive the funds.
County council requires this of us. Is that right?
The commissioner.
The commissioner.
So just
So this
Point
point
of-
of requirement. To receive funds.
So we're actually, so we're not applying, we've already applied.
We already-
That is correct.
Okay,
You're wanting to.
there you go. Then yes, this is us accepting the funds.
Any discussion or a motion?
we don't even know what to ask. You know, let me say this. Is there an opportunity for us as a board to pass a policy so that the department does not have to come to us to ask for permissions to do
It's
things?
state law.
So can you cite, which code is it?
Okay.
You could just pull that up so that we're all clear on which code this is. It is kind of amazing. For years, we've never done.
To be clear, it's, and I think Mr. Levin, you would agree with me here. There is no state statute that talks about applying for grants. It is for receiving the financial assistance, not for applying for financial assistance.
And Heidi, if you want that site, it's IC 162118, and I'll read it. A health officer may, on behalf of the local board of health, receive financial assistance from an individual, an organization, or the state or federal government. The financial assistance must be approved by the county executive or city fiscal body and the local board of health. And I actually looked on the state board of accounts, the Indiana State Board of Accounts, they explain the statute and they specifically state that the county executive and the local board of health separately have to approve
The
financial
receipt of the monies, but we don't have to approve application.
Not by state statute.
Okay,
But by commissioner statute, so.
Yeah, I would not want to spend all that time working on something and like we have done and people in this room have done, and then it's not approved. So that is probably the point of it, is to approve it at the board and then the board appeals to the commissioners to please approve this. Because then it's kind of like a pre-approval, because remember I asked about
I guess,
why
you know
do
what,
we have to do
do you know what
that?
I really, here's the essence of what I'm getting to. We're creating layers and layers of bureaucracy. And I thought the idea is like to simplify things, right? Like, let's make it less bureaucratic, let's make it smaller government. And instead, what's happened is that there are all these additional layers and it delays everybody and who knows what statute, et cetera, et cetera. So I'm just stating my piece. It just feels so laborious. And now we're going to have special meetings by Zoom, pulling us out of our day jobs to just go, yep, you can apply for that.
Well, we need a special meeting by Zoom anyway, because those would be for, I mean, if there was approval that was on a tight time frame too, because my understanding is that that also happens if the grant, sometimes the grants are awarded and you've got a really short time period to accept them as well. So this policy would need to go either way.
You know, it's just for years, we did it a different way and it all worked out.
And if I could, just for the
fine,
record, Kristen, in response to, we appreciate that you would, that you are lobbying and making trying to make a persuasive case that we not put in a whole lot of work and then get nothing for it. But in fact, the reality is, that's exactly what's happening.
Yeah,
The city
yeah.
commissioners have already signed off on these things.
Yeah.
Board has already approved it, and yet we have to wait for the county council to appropriate it. And as we have seen now on multiple occasions, the county council has.
You weren't here when I said, well, can't we just get it to approve pre? And they said you have to run for office and change the state law.
Yeah.
So somebody do that.
But that's the appropriation part. So we're going to do this anyway. So
I agree with your comments. I know you can find a way to streamline this for us. Let us
And
know.
maybe that's what we could ask. Very funny, but maybe that would be incredibly helpful. I mean, you know, it's a volunteer board, you know, all of us have full-time jobs and.
Do you have to have a certain number of people that vote to approve it? Okay,
Yeah.
how many is that?
Okay, so we're talking about the Nacho Mentor Program. We need to approve the receipt of those funds. So I'll entertain a motion if somebody'd like to make one.
Move to approve receiving the funds. How much money is it anyway?
That's a good question.
$100,000.
Thank you.
Will we have a chance for questions?
Yes.
Okay.
But we need a second. Motion, second.
I'll second it so that we can
Thank
ask
you.
some questions.
Any discussion?
Yeah, so I had, you know, I had questions. I was emailing Robin and to figure out how much money, both how much money had been spent, already, or not had been spent, but how much work you had done already, how much work was left to be done. It seems like you're about halfway through the process. So about half of the salary recovery, I guess, would already be spent. And but then I'm not sure why, I guess just explains, I'm not sure why it happened, but the information that gone to the county council was that you can find on their agenda. That's where I found it, on the agenda center, just on their agenda. That information was different than what we had gotten. And so that's why I emailed that to everybody today. It has the grant application and things. And what was on there was that it's $100,000 grant. And you said about $55,000 of it seems to be contractual services and miscellaneous costs. And then you said that, Robin, that to get everybody up to speed, you said that it's going to be used for supporting community stakeholders, which is that giving them, like giving some of the money through that?
They would receive a stipend for some of their overdose efforts, since it is, we've worked with our overdose response partners since really the end of 2018. We have an opportunity here to potentially support some of their efforts, so we would do that through a stipend, and their support of the Department of Health's effort to coordinate and convene and steer these efforts.
Okay, so, and then you said the 525 Foundation Annual Prevention Conference. So what exactly are we gonna, it says that we're gonna help support a specific portion of the grant would, what?
So
portion is that?
the 525 Foundation is a foundation started by Becky Savage, who lost 2 of her sons to an accidental overdose on the same evening. She last year, for the first time, hosted an annual prevention conference. Our community has never hosted one of those. And we did support that last year as well. We had some leftover state funds where we supported a individual from the Indiana University School of Public Health to do expert training for individuals that attended the conference. So expert training is screening, brief intervention, referral to treatment. It's largely targeted at primary care providers to identify individuals most at risk for potential substance use disorder. So we would like to use some of the funds awarded here to continue to support that convening of stakeholders in our community, also in the region, to address substance use, prevention, treatment, recovery.
So are you sponsoring a particular speaker or like a
Potentially.
particular,
Yeah,
like one of the specific
the thought
costs?
is we would have, the thought is, yes, we would support their pre-conference day, which focuses on our boots on the ground workers. That is our law enforcement, as well as our mental health professionals. And again, use an individual out of Indiana University who focuses on self-care and laughter, humor, to, you know, help people that do a really difficult job every day. And that's something we had thought we would use those funds for.
And when is the conference?
It will be June 19th,
Okay.
20th and 21st. So
when would you need the funds by? Like, when would you have to have access to the funds? In order to, like, do you need, like, you need to, like.
Yeah, I'm quoted in a news story, actually, from
Okay.
last month that said we would have naloxone boxes already placed, which this grant is holding up.
Okay,
I was also
Okay.
supposed to attend a conference in April that this money would have been used for as well.
okay.
So
Okay.
as soon as we can have them appropriated.
So
great.
like the naloxone boxes are,
You're now having
Or-
to use taxpayer dollars
Okay.
to send her to a conference where she is one of the nation leaders
Yeah.
in substance abuse, reaching out to other states. And here we have money coming from the outside, from the National Association of County and City Health Officers here to our county saying, send your expert to this national meeting. And we don't have the money. Now we have to use our county taxpayer dollars. It makes no sense. Yeah.
okay. I think, I think. Okay, and so, I guess I have two more questions. So first of all, does the health officer in the department, how much discretion do you have over the funds? It sounds like you've already promised some things, though. I mean, like, you're promising grant funding to the conference.
Just a point of order. I remember in the day when Dave Keckley was our attorney and he was always reminding us about what is daily business operations that the health officer governs and that we're at the policy level. I just wonder that this detailed level of conversation, it feels a bit like daily operations. I'm just putting it out there, but that the statute says that we're not supposed to participate or get involved in daily operations. I'm just putting it out there for discussion. It feels like we're moving into that direction of daily operations. And I wonder if we should pull back a little bit from that.
So I do normally agree with you, but there was a number of emails going back and forth, and I think timing on this kind of ran in, and due to the fact your motion didn't have a second without Ellen, I'm worried that it won't pass without her line of questioning getting satisfied. So I just let it go, and hopefully Attorney Rylander satisfied and we can get the votes needed.
What was the first part you said? You what? You, when you said Heidi, the very first words you said, I didn't hear.
About the line of
statute,
conversations,
yes.
emails going back and forth.
No, about the statute, about that the board is focused on policy, not day-to-day operations. Like, what's your interpretation of that?
Such and such, we don't focus on daily operations, but if you want grant approval and you don't have enough votes, it's not gonna go through, so.
Okay, okay, that's cool. All right, just raising the issue.
Ellen, to your question, the budget is, anytime a grant is written here at the Department of Health, it is done so with colleagues that will play some sort of role as well as Dr. Bob.
Okay.
So he was involved in all of these conversations.
Okay.
And before a grant is ever finally submitted to an organization, it receives his and most times Dr. Fox's final sign off.
Okay,
So when he asks me, Robin, how do you anticipate to use this grant? Why do we need this grant? Most times I'm already coming to him with a budget in mind. And through the process, this budget in particular, Amy will second this, took 8 different revisions to not just satisfy how we wanted to use the money locally, but more importantly, how it satisfied NACCHO's need to address the issue.
I guess part of my question is, I'm just curious if, because we're in this unique situation, we're gonna have a new health officer in 2.5 weeks.
Mhm.
What sort of flexibility will he have?
Speak freely.
As long as it's consider it constructive.
It depends on your perspective.
My perspective.
We're experts, Ellen. We're experts in public health, and you, by your own admission, are not an expert in public health. I appreciate your questions, and from the very get-go, I met with you on multiple occasions and said, you have my cell phone number. You know where I'm at. I'm available 24/7, 365. I gave that information to you, and I said that to you. I worry very much that this sort of of investigation occurring and taking up the time of all of my team here is demoralizing. And
Dr. Bob.
I am very.
Dr. Bob,
Yes, ma'am.
given last summer, you went through a series of public meetings where you said things that were attacking me personally and attacked my family, my young children.
I didn't,
I-
it was a hypothetical, you know.
I- No,
All right, let's cut it off. Go
yes,
ahead with the
yes.
questions on the nacho.
What I want, really what I wanted to know, I mean, and bringing up experts is a good point. Is this something, I mean, part of my question is if we're saying that the new health director might be locked in to doing certain things, then maybe we should table this so that the new health director can take a look at it beforehand. I wasn't thinking that way, but from what it's sounding like, maybe that's the way we need to go.
For my 2 cents, the commissioner signed off, we received the grant. I think it's just a bad move to not just let it flow.
I don't think anybody's locked into anything when they come in and there's a change of.
There's always
Art.
opportunity of
You know,
budget revision.
yes.
I mean, and I think he's right. I mean, I think it just behooves us to go ahead at this point. I mean, otherwise the money goes nowhere.
Is that the only grant we have, just out of curiosity, for this type of mental health stuff?
Well, we have this NACHO mentor grant, but then we also have a NACHO ACEs suicide overdose intersection grant that will be forthcoming, right? Amy, I think. But that's.
And again,
Yeah.
the support we have for the ACEs,
Yeah.
some of that is grant funded, the community health workers, some of that is grant funded. We were appropriated $2.66 million by the county for the behavioral crisis facility that was clawed back, as you know, but we did have that grant as well. So we've worked very, very, very hard to try to address what is one of the top 3 problems in this county.
All right, so, I mean, as long as there's some flexibility there for a new health officer. I guess the only last thing, and maybe this is more by way of advice, that I know that there are concerns at the council level with the fact that there's a health equity component, because that's a I mean, I know people might disagree with how I say it, but it's a politically charged term. And I wonder, Robin, if you'd be willing to share some of the materials that you've had, that you've developed and using for this program with the board and probably with the council too. Any, things that you've sent to your mentee counties. Because I think, I know for me, talking with you and over email and has been very helpful in clarifying what's going on. I think that level of and having that additional clarity with regard to that health equity aspect and what that means will be helpful.
No, most
So-
certainly.
Okay,
Yeah,
great.
One more, I know, I'm sorry, and then we can go to a vote, but I need to speak to Ellen's comment about health equity being politicized. You say that as if that is normal. That's not normal language. We don't politicize health equity. Health equity means that we provide services in an equitable way to all the people in our community, so that everyone has access to healthcare. It's not politicization. That is the essence of public health. I need to give you this definition because by your own admission, you don't have this background. This is my background. Health equity is exactly what public health is. So I take great offense at the idea that it is now being a term that's being politicized. Let's not engage in that. Let's step away from that kind of language, not normalize that, because that is not the case. And in fact, just about every stinking grant you apply for now at the university level, everywhere, health equity is now included because they want to make sure that everybody in the room has access to whatever it is that we're applying for. So we have to be really, really careful that we don't contribute to sort of normalizing this idea that somehow equity is a 4-letter word, because it's not.
No, I don't think I don't want to get into a debate over the use of the term health equity. What I'm just trying to convey is that because people have different ideas of what that term means, it is probably helpful that, especially when we're dealing with grants that have that as in their language, that we have clarity over what exactly is being done. And because what actually is being done might be something that everybody agrees with. It sounds like some of the things that you're talking about using the funds for, I don't think anybody in this room disagrees with them. I mean, I think using funds for that, what is it, the 525 Foundation, that sounds good, you know.
On that note, can I call the question?
Yes.
All right, all those in favor of, are we accepting this, are we accepting this grant? And I need a number count here, so say aye.
I,
Opposed, say nay. Chair votes aye. Did you abstain or?
Is it still gonna pass?
Yeah.
I'll abstain.
Okay.
I'll abstain.
Thank you. Next item, 2319. Health, community health workers for COVID. This is an application. So we just need to approve the department to go ahead and apply for this grant.
I will make the motion to approve the application for this grant.
We have a motion. Do we have a second?
Come on, folks, we got to have a discussion about this. We can't not have a discussion about this.
I'll second.
We're just applying for it. Right.
Okay, we have
Thank
a
you.
motion and a second. Any discussion?
Is this the third year for the grant? Is that correct?
Yes.
Okay.
The third and final year for this grant.
Okay.
Just, and does it only have to be used for COVID? Like, meaning
No.
there's some
No.
discretion, right?
Right.
Okay.
Right.
Meaning, because not that this sounds bad, but COVID's on the downslope and we still have a lot of other big problems,
And
right?
that's exactly,
Well,
exactly why we're
Okay.
moving in the direction we're moving.
So,
Exactly right.
so even though the language kind of says, you know, we're gonna use this to fight COVID, it's broad. I mean, that is not necessarily the CDC's expectation
That
anymore.
The CDC actually was hoping. And this is by verbal report to us in the beginning of the communications and the meetings that we have with them on a regular basis. They were hoping that departments of health would do just what we're doing with this. That is, it's COVID money, recognize that we need to fight COVID, but also then expand to other medical conditions. So the move to cancer is exactly what they're wanting to see happen. Again, it's, as we were talking about previously, it's resource navigation, it's insurance navigation. It's having the opportunity to listen to the people about what they need and try to empower them to get whatever it is they need as it relates to health.
So I have procedurally, so we're applying for the third year of funding. And then that goes to the Board of Commissioners and they have to decide whether to accept it. And then we apply and then it comes back to us, correct?
To receive.
To receive the grant. How long will the application process itself take? Is this, it's the third year, is this just kind of like a quick renewal or resubmit or?
You want to talk to it?
Yeah. Yes, sorry, I was gathering my thoughts and my composure, to be fully honest. So this grant would take anywhere between pulling a full annual report, basically, of our community health worker program as it pertains to the CDC-CHWs. That is basically an accumulation of all of the monthly reports that you have in front of you or have had every month since August of last year. Then we will go into and do a qualitative portion of it, which is the storytelling, because the CDC requires that at least 3, if not more, stories are shared every year with them to show successfully what those quantitative numbers mean. So we will go through the stories every week. Our team meets and says their successes and challenges and say what is going well and what do they need assistance with. We will take those successes, write them down, and then send those in as well. We will also then create a year 3 budget and a year 3 work plan as it goes into our over comprehensive work plan that I submitted in year 1 when we went for the grant the first time. This will take me and Cassie and those of us who are working on it with the final revisions up to the entire, when it's due in April. If you do not approve of it today, we will not be able to move forward because of the amount of time it takes. I also beg you, you have said and stated very clearly that you do not want us to go for grants that are not going to be successful. If you do not back this, if you do not support this grant.
Please don't threaten the board. Be careful with your.
I'm saying like, if you don't do that, then please don't agree to let us apply for it. Don't vote for this, because if you do that, we submit a bunch of reports that then go nowhere. So if you don't agree with it now, don't say yes now, and then when the money comes down, you say no. Because I have a team here who are sitting around me who are saying, will I have a job past August? That's what you're voting on. Will the CHW program, specifically the CDC CHWs, continue past August? And so it takes about a month to finish the entire report. We have office hours with the CDC. I have 3 or 4 of them, plus our monthly report with our monthly one-on-one with them the first time of each month. Those will all be times for revisions to be submitted. So we submit multiple revisions to them for final approval before they submit the final into the AMP system that we utilize. So it's going to take a full month from start to finish.
That's a good point. We should have mentioned the deadline for this is April 20th, 21st.
21st.
So its time is up. Yes.
And just to clarify, when you get a grant and you have your proposal of how you want to use this money, it's not, you're not locked in like what we are with the grant, with the money that we receive for donations, like meaning it's like, as you go through, if you're like noticing like, oh, look, we need to put more money into this, or this is completely gone, we don't have to deal with this anymore.
Depends on the
Is there-
depends on the magnitude of the dollars, we may, and depending on the magnitude of the shift, we have a certain leeway. But if it gets too big, we have to go to the CDC and get their okay.
Okay.
Which is what we did for the campaign. We had to go to them because we were utilizing a certain percentage of our funds for the year. We had to go to them and say, will you approve this change of funds? And we didn't originally go into year 2 planning to do a marketing proposal. It wasn't until September that we realized we're not getting enough numbers from people. So we're going to change our proposal from that. And every month we reiterate whether we want to continue a sort of portion of our project or what project needs more funding. And that is influenced by the CHWs a lot of the time. They're the ones coming to us saying, hey, we need more of this because what we're seeing in the community is this. And so in direct response to the needs of the community that is voiced to the CHWs, that is where we choose to put funding. We have an overall.
And the grant's more, but it's more generally written, correct?
It gives us some leeway, but clearly, as with almost all grants, a major portion of the grant is it's what's called a monitoring and evaluation plan. So the monitoring and evaluation plan is set up such because we know that we're not going to do everything just right. I mean, I like to say we never fail. We just try to change things a little bit as we move along the way. So there's a lot of self-correction that has to occur. And what guides our self-correction is this monitoring and evaluation. We get that data, we look at it collectively as a team, or sometimes depending on the nature of it, maybe just the leader, and then decide, okay, this we're doing really, really well. This we're not doing well. We either change this, and so that's how these grants play.
But being is that it's a 3rd year on a COVID grant and it's not, I just want to make sure this isn't just a COVID grant, right? I'm saying that again, like, it's like,
Right.
This is.
Perfect example here being that we recognize that we have a great opportunity now. Our community health workers are known in the community. We know that we've not been doing enough on cancer. Can we do a little bit more on cancer and get some money to do it and reorient, still keep the same foundation? You know, what it takes to train a community health worker, developing the relationships with the community, the learning of the insurance navigation and blah, 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 blah. The foundation is still the same. Now we're going to add on, and I just started, in fact, this week, with some presentations, group discussions on how can a community health worker be effective in.
The grant is fluid enough that it's not. That's what I was trying to.
It's mostly to focus on, it's COVID-19 and health disparities. And so we focus very heavily on the health disparities like cancer or cancer prevention or social needs assessment, things like that.
And when we talk, and just so that you're clear, and I don't mean to sound so pedantic, so apologies for that. When we use the word disparity, we're talking about differences that we think we can fix. Differences that we think that can be fixed.
Across everybody.
Across, well, it can be across, it can be age,
Yeah.
It
Doesn't
could be
matter.
Across location.
It doesn't matter,
It could be
Craig.
across gender. I mean, it could be across a whole lot of different things, but there are so many different disparities. And one of the things that she does is she tries to look at all of the various health conditions, or at least the major ones, and figure out, okay, where are there disparities? Where should we be doing better? And that's what Mary Washira does. That's her job.
Yeah.
And by the way, just so you know, if I had stayed here 1 more year, I guarantee you those community health workers would have been far more engaged in mental illness and addressing that problem. We'll see what happens, but that's not on the docket right now.
Wow.
All right, thank you. My 2 cents, for third year, 3-year grant, and done a ton of good things in my life with the money we've had. And seems to me we wouldn't be wise to say no, but that's me. Throw that out there. So we have a motion. Any other discussion? All right, all those in favor say aye. And again, I need a count, so.
Aye.
Aye.
All right, and chair votes aye, so 5-0. All right,
Point of order question.
sure.
So as we were taking the the vote on the new health officer, we talked about interim versus full and so forth, and you made the comment that Dr. Migliori was an essential person in making those decisions. She submitted this letter, you all got, Jenny just handed these out from Dr. Migliori, and she said, please accept my vote of confidence for Dr. Serban as interim health officer. I don't know if that changes anything. I'm just asking for a point of order.
Well, she didn't vote. That's.
I know.
Yeah.
So she was under the impression, though, that she was hiring an interim health officer. And at first I thought it was a typo, so I quickly texted her, and she was not aware that it was a full-time health officer. She did indeed think that she was hiring an interim health officer.
Okay. thanks for
I'm
the
just putting it out there that,
No old business. Board notifications, hirings.
So that's the,
Prenatal.
the
Perinatal.
prenatal perinatal led program coordinator, that's Nancy. No resignations, no retirements, no terminations in this month.
Okay. On the public comment, the public may public comment may be given in person. Input from the public can also be sent to the board by email, so everybody knows. At our regular meetings, the public is invited to address the board for 3 minutes regarding items posted or not posted on the agenda. Individuals may speak only once during this section of the agenda. Speakers shall properly identify themselves by stating their name and address for the record. Personnel issues are not to be addressed during the open session of the Board of Health. The board president may interrupt, warn, or terminate a personal statement if the statement becomes personally directed, abusive, obscene, or inflammatory.
John Hagan.
Thank you. My name is John Hagan and I reside at 1957 Jewel Avenue. That's on the south side of town. It's often ignored, so that's what I tell you. In any case, I often do not show up a day late and $1 short, but this is one time when I have. I was under the impression at the last meeting that you were selecting a committee, or that you had already had a selection committee to look for a new health officer, and that I wasn't aware of the timeline. So I needed to have the ability to speak from authority. So I went back to the group that I belong to. One of the groups I belong to is the South Bend Reparations Working Group. A small but dedicated set of folks, mostly long-lived in this community. It belonged to a recently established not-for-profit corporation whose mission is, can I read this? To advocate for reparations at the local, state, and federal level as a way of acknowledging and repairing the harm caused by historic and current injustices experienced by African-American descendants of slavery and its aftermath, and to educate the public on these issues. Well, we're relatively new, just recently incorporated. Many have served in several organizations throughout the county. And I think in ways that we are familiar with and to the health department, we pride ourselves in having fostered positive exchanges and ongoing relationships about being informed about each other's interests and values. Well, we come, or at least I was going to come to this group with two suggestions about hiring a new officer. And I say that as giving forth a modest proposal. I apologize if you have already adopted them in some fashion. Or I hope that none of what I'm going to suggest violates any state law or ordinance. And I hope it doesn't waste your time by stating the obvious. The obvious to me is, one, you ought to enlist an outsider from the county with a public health perspective to sit on the board committee to select a new health officer. Secondly, I would recommend that in the selection process, you hold public hearings throughout the city to gather, to invite participants to share their thoughts on what would be desired characteristics of the health officer, or if or the needs of their community that would be assisted and shaped by the presence of that officer. And unless this is a violation, that these become a policy of future board here hiring. Thank you.
Thank you.
Sam?
I have nothing to say. Thank you.
Taylor Combs? Hey guys, I'm speaking as a community member. I live at 1519 East Ewing Avenue, South Bend, Indiana. I serve as the president of a board for a local nonprofit. And I take that role very seriously. I feel very honored to have been selected as president of the board. I understand as a president of a board that my job is not to meddle with the day-to-days. My job is to oversee the budget, oversee that we are in alignment with our strategic plan, and oversee that overall the staff are reporting that the role that the executive director is doing is in alignment with our overall goals. It is not my job to come in as a non-expert and tell experts who have dedicated their lives and their time and all of their resources, and usually most of the people I oversee as a board president of the board, many years of college debt. I expect them to be the expert, and I expect that since we hired them, that they can be trusted to do their job. It is disappointing to me that the board overall does not seem to trust the judgment of the members of the Department of Health. We make budgets every day. We revise budgets daily. I just ask for more trust. You hired us. You believe in us. Bob believes in us. We've done a really good job. And it would be great if you trusted the rest of the people of this team to do their job every day, to come in and to care about this community the way that you expect them to. That would be wonderful, but it doesn't seem like that's happening, and it is discouraging. It is very discouraging as a community member, as a neighbor, and as somebody who wants to have a family here, that you don't trust the people that you hired to do their job. That's all.
Thank you.
And Carol Nash. Good afternoon or evening, I guess. I'm Ann Carol Nash. I live at 17791 Ashmont Court in South Bend. And first of all, I just want to express my great appreciation for our outgoing health officer and all the effort that he has brought to this position and all the very hard work and his expertise. And I don't think enough good can be said about what he has done. And I think that is true of this health department. You all are amazing people. My interaction over the years has not been real substantial, but I did get to volunteer with the COVID vaccine clinic. And I did in the past work real closely with health department people when I was involved with nuisance abatement and licensing with the city of South Bend. So I have some indication of how dedicated this department is, and I just cannot say enough good about it. And I too believe that what we should do is defer to those folks who know the most about the
these topics. And we should also go to bat for these folks when we, face bodies that seem to want to obstruct the use of funds from outside of the community to help our community. So I just thought I'd mention that. And again, just thank you so much for your kind work.
Thank you.
Judy Harden.
Judy?
Judy. Karen Vasquez.
Karen Vasquez?
They both left it, had to leave.
John Pinter.
Hi, I'm John Pinter. I live at 1224 Sunnymead in South Bend. I'm here tonight on behalf of the United Religious Community, which is the organization I run. We're not a recipient of any health department funding. In fact, we're one of your big customers. We buy 5 or 6 birth certificates per month on behalf of our clients. We appreciate that you haven't raised your prices, the director, and that isn't to put that idea in your head either. We run an advocacy center. You may have heard of us. We're an interfaith organization, try to get communities of faith to be involved in different ways. I think of us often as, we work cross with different houses of worship of all different kinds and try to connect them with government, with business, with a variety of things about what's a way that they can help in the community. We run an advocacy center as a result of that. It's been around for a long time. That's where we help people with birth certificates, but also with rent and emergency things like electricity. We stepped up big during the pandemic. We administered an awful lot of the ERA money that was out there that the county did a really good job of pushing out. When you hear stories of, it's 10% of it's been spent in St. Joe County, that wasn't happening. And that has really helped us as an organization connect the dots between how many people that we worked with and still work with, for whom health and disability and addiction, those kind of things were really aggravating features. So I laud the work of what the health department is doing broadly. I don't know the community health workers very well, but we are stealing that model. And this next thing I want to mention, which is we work very closely with refugees. You may know that our organization had 36 folks arrive almost all at once from Afghanistan, evacuated with very little in the way of health care provided before they left. And the health department and providers here really stepped up for that. So we laud that, hope that continues. Right now, we had a meeting today with our partners from Elkhart County providers here and hospitals. As you may know, there's a lot of Ukrainians that are in the community and came in a whole different way. And for the most part, their health needs aren't as severe, but the amount of folks that are seeking TB shots and that care is dramatically high. And we just appreciate the flexibility of the health department working with those providers to make sure that these new folks to our community who are welcomed here, number one, but also that their healthcare needs are being looked at. So going forward, I had no idea we would interact so much with the health department. We look forward to continuing that and feel that's a real positive thing. And I just wanted to take that opportunity and thank you for that. So
Thank you.
Thank you.
Marla Cadet.
My name is Marla Godet. I live in Osceola. I am a ACEs Master Trainer, Adverse Childhood Experiences. I am a Suicide Awareness Prevention Trainer and Certifier. In the United States, ages 15 to 29 is the second leading, suicide is the second leading causes of death in the United States. Somebody had asked about that. Why we have a council person making suggestions to where our money goes that was already donated. That's concerning. I don't things like that shouldn't be happening. Why the Board of Health has members that are not agreeing that money stays with the Board of Health is concerning. You're all on the same board. You all should be supporting the same mission. The board is for the Board of Health. So to say that money goes anywhere but to the Board of Health, that's concerning. All of those things to me should be investigated because I've never seen a board function to collect money for other things than itself. That appears to be where there might need to be some type of training or board development. This is my niece. Her name is Tara. I attended Tara's funeral yesterday. Tara's 33 years old. She is dead. Tara was born 1.4 pounds. Her mother never had an abortion, never had a pregnancy before her. She's totally healthy. Both of her parents are Black, both highly educated. When she was born, waited, got married, did the whole thing, car, family, house, all of that, and had Tara. Why was Tara born 1.4 pounds when her mother was totally healthy and none of those things happened prior to? And nobody knows, but she was Black. And people say that stuff doesn't matter. It had to be something else. Maybe, I don't know. But because Tara was born under those conditions, Tara was always interested in healthcare. Tara became a registered nurse. Tara has 14 articles published already in maternal, fetal, and neonatal medical journals. She was on her way to being a doctor because she wanted to study and be an OB-GYN and work to reduce birth equity and injustices, because why was I born at 1.4 pounds? She has studied, she's a researcher at Wayne State University in the Paranadiology Department, at Michigan State University in veterinary medicine, and the illustrious University of Michigan in the MedSor program. My niece, because of undue stress, had an induced seizure and suffocated in her sleep. There's many people who don't believe that that would happen. I was told, someone said, oh, things like that don't happen to professional people.
Thank you.
There you go. That's Tara. I will continue to work for Tara.
Thank you.
John, I would like to put on record, on behalf of the entire staff of the health department and myself. Thank you, Bob, for everything you've done for the group.
Does that conclude public? All right, thank you. Time and place of next regular meeting, April 19th at 4:30, right here in this boardroom. That will take a motion to adjourn.
I'll move.
Second, all in favor, say aye.
Aye. Aye.
Motion carries. Thank you, everybody.
Day.